So urinary incontinence just means the passage or leakage of urine, and in women, it can usually be due to two main reasons. It's usually due to what we call stress incontinence, which is not stress like your emotional stress. It means stress on the bladder in forms of pressure from running, jumping, laughing, coughing, sneezing. And that's called stress incontinence. And then the other type of incontinence is called urgency or urgent incontinence. And that is when women have leakage associated with a strong desire to void. An overactive bladder encompasses urge incontinence, but can also encompass just simple urinary frequency and urgency without incontinence. Well, all of these things increase as women get older. Stress incontinence tends to be more common in younger women. Most women will, who develop stress incontinence, the earliest they will have it is generally after having a child, after pregnancy and delivery. But it does increase with age, to the point that by the time women reach about 60 years old, up to 30% will have incontinence that is really bothering them all the time. As women get older, urge incontinence becomes more and more common, and in 80-year-olds, probably 50% of women have some degree of urge incontinence. The symptoms are generally just leakage of urine or involuntary passage of urine when you're not basically sitting on a toilet, and it's obviously it can be a very embarrassing condition and situation. The causes of urinary incontinence really depend, or are different depending on the type of incontinence you have. Like I said before, stress incontinence generally occurs in relation to childbirth. During delivery, the passage of the fetal head through the vagina can weaken the delicate supports of the urethra, and that's when women will start to develop stress incontinence. Frequently, when women are young, in their 30s and 40s, they won't experience the symptoms of stress incontinence because their musculature will still be quite strong, and strong pelvic floor muscles can compensate for weakened supports of the urethra. And so doing Kegel exercises will definitely help prevent stress incontinence from getting worse, and will even treat some of the symptoms of stress incontinence. So Kegel exercises or exercises where you're strengthening the pelvic floor are always really helpful. Urge incontinence tends to develop later, and what's happening there is the muscle that surrounds the bladder is called the detrusor muscle. And the way that our bladders get urine out of them is the detrusor muscle contracts when we sit on the toilet. There's a very complicated communication that's going on all the time between our brains and our bladder. And when we are toilet trained at 2, our brains maintain control over that detrusor muscle. It basically tells that muscle, don't empty until you're sitting on the toilet, and this is a socially appropriate time to empty. And that we maintain continence, and then as we get older, some of those connections are lost, and the detrusor muscle basically just starts to contract when it wants to, and it's not under as good firm control from the brain anymore. And so patients start to leak urine. Basically, the detrusor muscle starts to push the urine out when they're not on the toilet, and that will lead to leakage. Ways to prevent or treat urge incontinence is there's a lot of behavioral things that can be done. We know that things like coffee, alcohol, and citrusy things are very irritating to the bladder. So patients who have urge incontinence can try to cut back on these types of fluids. Kegel muscle exercises can also help as well. And also understanding that as you get older, you can't hold your bladder for as long. The bladder just can't hold 18 ounces like it can when you're younger, and you simply just have to sometimes just go to the bathroom a little more frequently as well. So again, Kegel muscle exercises combined with pelvic floor physical therapy really can be a first-line treatment for both stress and urge incontinence. Dietary changes, like I mentioned already, can help quite a bit with urge incontinence. In women who've gone through menopause, sometimes vaginal estrogens can help a little bit with urge incontinence, in that once women go through menopause, the tissues in the bladder and the vagina get a little bit irritable, and that can make urge incontinence worse, because anything that irritates the bladder will make urge incontinence a little bit worse. Those are generally the first-line treatments for stress incontinence, and that's the leakage where you have a weakened supports of the urethra. There are small devices called pessaries that are a little ring with a knob on it, and that knob, they're placed in the vagina. The vagina is just below the bladder, and by placing these devices in the vagina, the little knob will sit underneath the urethra and give a little support to the urethra, so that when a woman coughs or sneezes, the urethra will get pushed under and against this little knob area, and that can help with stress incontinence. And then finally, for stress incontinence, there are surgical options. Placing a sling underneath the urethra that essentially recreates those urethral supports that have been lost is another option. And this is a minimally invasive option. You're in and out of the hospital, the surgical area the same day. So that is, and it's up to 90% effective. So that's a good option for stress incontinence. For urge incontinence, again, pelvic floor physical therapy can help. Moderating dietary substances, and certainly decreasing irritants such as coffee, alcohol, and citrusy drinks will help. And if that doesn't work, there are medications that relax the bladder a little bit that can work pretty well. There is a acupuncture type of procedure called posterior tibial nerve stimulation. The nerve that innervates the part of the leg around the ankle is very similar to the nerve roots that innervate the bladder. And by stimulating these nerves in the ankle, it's been shown to help with urinary frequency and urgency. And that is a very safe, really no risk option for patients that have urge incontinence. And then if those things don't work, we have Botox injections. Botox is a substance that paralyzes muscles, and that is injected directly into the bladder wall. It is done after giving some anesthetic to the bladder, so to decrease the pain. So there's a variety of different treatments depending on the severity of the symptoms and what's been tried before. I think that there are a lot of different options, and there's also a lot of different causes and reasons for women to have incontinence. And a lot of times I presented it like it's urge incontinence or stress incontinence. And the truth is a lot of patients have both. And so I feel like as a practitioner, I spend a lot of time with my patients really trying to discuss their lifestyle with them and figure out what parts of incontinence are really bothering them so that we can treat what actually is really bothering them. I mean, the truth is everything with incontinence is quality of life. And so it gives myself as a doctor and a clinician some flexibility in terms of really working with the patient to outline what her objectives are, because there are a lot of treatment options and they really depend a lot on what your expectations are as a patient.